So Madison, tell me why you're here.
So about 7 months ago, I started getting really dizzy, and I wasn't sure what it was. And I've seen a neurologist and an ENT, and no one really knew what was going on. And as the months have progressed, my symptoms have gotten worse, and so I have like a lot of jaw pain, clicking in my ears, like jaw like snapping kind of.
Okay.
And like visual disturbances.
Did you see anybody for the visual disturbances?
I had an MRI done and that came back normal. I do get migraines with aura, but no one has known, no one could give me like solid answers.
Okay. So you were diagnosed with migraines by your neurologist?
Yeah, I guess I did see, when I was about 12.
Okay. Were you on any preventatives or? You came? Okay, so you just basically dealt with them when they came.
Yeah, and I have like, I think I'm on some triptan medication when I do get them.
Okay. Does it work?
Kind of. I usually have a really bad headache for the next, like, the following day or two. But it does keep, like, the visual aura kind of at bay.
So when you get the headache, can you localize where it's at?
It's usually, like, frontal. And I've really noticed when I, like, put my head, like, move my head position, that's when it, like, it's almost like a bowl of water, and it, like, tips, and the pain gets worse.
Okay.
Does that make sense?
Yeah, it absolutely does. How often are you getting headaches? Do you have like a constant low-grade headache? Or does it just kind of fluctuate?
It fluctuates. I wouldn't say a headache, but it's more jaw pain recently. But normally I would get a migraine like once every other month. And sometimes it's more, sometimes it's less.
Okay.
Yeah.
So any, besides the vertigo, any inner ear issues like hissing or ringing in the ears or a fullness in the ears?
Yeah, there's fullness in the ears, there's ringing. It's almost like, I was trying to like think of the word, but almost like water. Not water, but like a kind of sound.
Okay.
I don't really know how to explain that.
Sure. Well, I mean, you just did.
Yeah.
Everybody's sounds that they hear in the inner ear is slightly different.
But there's definitely ringing. Like it's gotten progressively worse. But like now it's almost every day.
Tell me about neck pain and shoulder aches. Any of that going on?
Yeah, it just feels like I need to like stretch it, but it never gets stretched. So like definitely like on the sides, kind of like going from here down.
Okay.
Yeah.
All right. Does it flare up with the headaches or the jaw pain at all?
It's pretty continuous.
Tell me about the limited opening. How did you notice that?
Like my ability to open.
Sure.
It just feels like tight if I like try to open my mouth all the way. I feel like I am able to open it pretty wide, but it's pretty painful and just tight.
How do you sleep?
Recently, not very well.
So tell me about recently. Is this about the same time as the vertigo?
No, I think my sleeping has gotten worse like in the last couple months. And I started feeling my symptoms like 7 months ago.
Okay.
But the sleeping has kind of gotten disturbed like within the last 2 months. And that includes like, I guess I've always kind of had trouble falling asleep.
Okay.
So I have that, and then I'll wake up in the middle of the night.
So what happens when you wake up in the middle of the night? Is it you notice that you have, you're kind of sore in one position? Do you notice some of the symptoms that you were talking about? Do you notice you're clenching or grinding? Does that wake you up, or?
No, that doesn't wake me up. However, I do feel pretty like tight in the morning, like my shoulders and my neck and even my jaw. I feel like, because sometimes I do get like so dizzy or like my vision just isn't focusing. It almost feels like an out of body kind of experience.
So, okay, do you either...
Sorry, I was gonna
No.
mention, I forgot to say that originally it was my right side that was in a lot of pain, and then it switched to my left side, and now in the last few days it's back to my right side.
So when you were coming over here and you had the cold water and you had that and you're like, whoa, there's a little sensitivity there. Was it on the right side?
It kind of was like on all my teeth.
On all your teeth?
Yeah. Yeah, definitely on my front teeth. But I feel like a pressure like on all my bottom teeth, like from my gums. And that's kind of like where I felt it in a way.
Sure.
But like also on my teeth.
Okay.
Um,
Has the pain and altered your quality of life? So tell me about that a little bit.
I feel like literally in every category of my life it's changed something. Like my I couldn't take classes last term. I had to quit my work. I feel like it affects like my relationships with other people, my happiness, my ability to be like active and everything. If you ask me like on any subject of my life, I feel like it's touched
Okay.
or affected it somehow.
Relationships with people, like, what do you, like, does it bring apart, sometimes it develops as a depression or anxiety, and even sometimes it's anger, and so that when we're feeling pain, that comes up and that affects. So can you just define a little bit what you're talking about interpersonal relationships?
I feel like it's definitely brought up anxiety and some form of depression. Just because I feel like I can't do the things I want to do because I'm always in pain or dizzy or just like not feeling well.
So, Madison, what I want you to do is we're going to do an ice water swish test. You put down on your intake form that you didn't have any, you didn't have sensitive teeth. So we have some ice water, and what I want you to do is to kind of take a mouthful and swish it around for 5 seconds. And there's a second hand behind you, and I'm going to let you know when that's up.
Okay.
And then you just swallow it and it's gone.
Okay.
All right,
Good.
go ahead. Good. Now swish it around. Swish, 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 swish. Okay. Now swallow.
Definitely.
Different?
It just was more intense.
Okay.
On the
So
bottom.
on a scale from 1 to 10, 10 being a kidney stone and 1 is I feel that it's cold.
Probably like just a two
Two?
or three.
2 or 3. Okay. Madison, you just finished up round 1 of DTR. Tell me what you notice.
I notice a lot more relaxation just like in these muscles in my jaw. And I notice it used to be really painful when I would move my jaw side to side, right to left, and now it's like there's no pain at all.
Cool.
Yeah.
Well, good. You're having quite the experience on the first go. And what about your bite? When you bring your teeth together, does it feel like you have a repeatable home?
Yeah. It definitely feels very new. It feels different. But again, it just feels like before it would be like really tight and like just really tight. And now it's when I bring my teeth together, it's a lot less relaxed.
Okay. A lot less relaxed or more relaxed?
Or sorry, yeah, more relaxed.
Okay, just want to make
A
sure
lot
we
more
were
relaxed.
thinking the same thing. Okay. Anything difference in your neck, in your neck or shoulder as far as how they feel?
Yeah, actually, when you were making some adjustments, I could kind of just like feel my shoulders just kind of like relax.
How crazy is that?
Yeah, it's crazy.
And you haven't even left the office yet, and so we've been at this for about 31 minutes. Most of the time, you know, we were up in this position measuring, and the other time we were taken away. And fair to say that there's teeth in your mouth we didn't even touch?
Mm-hmm.
Yeah, okay. Anything else?
I think that's it.
Okay. All right. So let's do the ice water thing again.
Okay, yeah.
Let's see. I've got
Ice water?
I've got actually ice in here.
You do?
Yeah. I'll put,
I can just drink it.
but
Oh,
I've got ice in there.
oh, it's just that, yeah. There you
This
go.
is
Okay.
water.
That's fine.
Yep, there's a lot of ice in there.
Patient brings her own ice water to the ice water swish. I think this is a first.
Yeah.
Go ahead and see where you're at. Swish it around a bit. Okay, that's well.
It's definitely less sensitive. It still feels really cold, obviously. But before it was like, whoa.
And so where it was sensitive to you, just refresh me. It was on the lower anteriors. Yeah.
Like here.
And not as sensitive.
Yeah.
So you said you were a 2 last time,
Like a 1.
like a 1. Okay, so
Less.
50%,
Yeah.
1 or less.
Uh-huh.
But you just noticed that it's cold.
Yeah.
Now, what is puzzling is, did I adjust on those teeth that were sensitive?
Not
So
at all.
what's going on there? Yeah. So there's a lot of sympathetics and parasympathetics that go on with the central nervous system that is in tune with the bite. And so you really didn't even have any friction in the front according to the T-scans. All your friction was in the back. But they're all kind of linked somehow to
Yeah.
each other. Otherwise, how would that work that the front teeth that weren't in friction and weren't adjusted upon, now they're feeling less sensitivity?
Yeah.
Okay, Madison, you're back with us for a second revision, and I wanted to get some feedback from you. Just how was the night after having your first DTR visit?
So I woke up once around 4, which is pretty normal. Usually I feel like really like tense and like kind of like anxious, but the night after I had DTR, I felt like I told you on the phone, like my body felt like better, and I was I wasn't anxious at all. I was very relaxed, and then I just fell right back asleep. So
Okay.
it was really good.
All right, so you've noticed, even in the short week, you've noticed, well, less than a week, physiologic changes that really kind of brought you in. So overall, things are
They're headed in the right direction.
okay. All right. You had some tension today when you first came in. We just did our second revision. Tell me how you feel now.
Yeah, so I had like a lot of tension on my left like neck and back, and now it feels a lot more relaxed.
Good,
Yeah.
good, consistent. So you'll probably notice more change as we let you heal more, and we'll definitely continue to follow up with you. And okay, Madison, you're back with us for another revision. I just wanted to get some information from you on how you're feeling. How are things going?
I would say overall a lot better. I'm definitely starting to feel good.
Good, good. So you were having pretty chronic headaches and migraines, and you had mentioned that you had only had one bad headache, but it wasn't as bad as before you entered treatment. Is that fair?
Yeah.
Okay, all right. So, and it's quite possible that that is something that's going to remain. Like, you're going to still get headaches.
Yeah.
That just means you're normal like everybody else.
Yeah.
But they should not be the same frequency, intensity, duration, all of those things like you were encountering before.
Yeah.
So probably one of the most interesting things that I like to follow are all of the outlier symptoms, like things that I've never heard of before. So you made a comment first go around that you were having a problem eating, or I'm sorry, you were having a problem reading with eye tracking.
Yeah.
So tell me what's going on with that.
It's gotten a lot better, especially like physical, like on paper. I've noticed when I watch TV and read, it's a little more difficult. It's gotten a lot better overall.
Good,
Yeah.
good. Inner ear issues such as the ringing in the ears and hissing.
I'm still experiencing some ringing, but it's gotten a lot less frequent. I probably get it once or twice a week.
As opposed to what? What
Um,
were you getting?
Probably like 4 or 5 times a week.
Okay.
Yeah.
And then what about vertigo? Dizziness.
That's gotten a lot better as well. I notice it more, I think, when I get tired. So when I first wake up and then more in the evening, it's kind of not vertigo, but just kind of uneasy, I guess.
Okay.
Yeah.
So the room's not full on spinning, but you
No.
would say a lightheadedness maybe, or?
Yeah.
Okay.
Yeah.
All right. What about the shoulder and neck pains?
That's gotten a lot better. I'm a lot less stiff.
Okay.
Where I feel like before I really held like a lot of my tension in my neck and shoulders, and now I don't have any pain or anything.
Well, good.
Yeah.
Good. Okay, and then you said, what about the clenching? Are you noticing clenching in the mornings when you wake up at all? No.
Yeah.
Okay, that's good.
Other than the jaw.
Yeah, any jaw pain? No. Okay.
That's
Well-
really resolved because
Yeah.
you really did have a lot of issues. you
Yeah.
know.
Even like the tightness. Like I
'Cause
remember
you
it
were
was
always
feeling
doing-
really tight. Yeah. That's gone.
Are you happy you decided to go down this route?
Yes. Nice.
Okay.
Prometez